Well, welcome everyone, and thank you for joining us for today's Mental Health Awareness Month webinar presented by the Boston Home and EMD Serono. Our topic today is managing mental health for people with multiple sclerosis and other progressive neurological disorders. I'm Victoria Stevens, the Director of Communications at the Boston Home, and I'll be helping to coordinate today's webinar. It's my pleasure to introduce our speakers from the Boston Home. Our speakers from the Boston Home today will be Alex Burnham, who is our Director of the Boston Home Institute and Rehabilitation Services, Kerry Donahue, Director of Activities, and Liz Key, Director of Social Services. Alex will be introducing our other speakers and leading us through the program. But before we get started with that, I just wanted to take a moment to thank our sponsors for supporting the Boston Home in addressing this important topic, and also to just go over a little bit of the format for today's event. We ask that everyone remain on mute throughout the program, and please use the chat. My colleague, Ali Cahill, who's our Director of Philanthropy, will be monitoring the chat and sharing questions at the end of the webinar. I would also encourage you, if you have comments or something that you'd like us to address later, you can also reach out and we can share contact information as well. So with that, I'll hand it over to Alex.
Excellent. Thank you very much, Vicki. Hopefully everybody can hear me okay. I'm in COVID quarantine currently, but I'm feeling okay. Thank you all very much for joining us today for this, what we feel is a very important and often overlooked topic in the management of multiple sclerosis, which is the consideration of mental health services, mental health challenges, but also specifically how, with paradigm shifts in care and availability and our general global experience during this pandemic, we want to make sure people have a better understanding of what it's like for somebody who's managing a chronic illness like MS to be navigating this very unfamiliar world for all of us. Over the past year, I've been at the Boston Home for 13 years, and for those of you whom I haven't met before, I serve as a speech pathologist and oversee our rehab department, but also we have our TBH Institute, which provides education and outreach opportunities such as this webinar that we're putting together and that Vicki and Ali have wonderfully set up for us today. Thank you again to all of our sponsors who have valued this topic as well. But in the 13 years that I've been at the Boston Home, I've definitely noticed far more in the past year during our conversations about what are some concerns that residents have or what are some concerns that families are mentioning. When I first started, the vast majority of them tended to be more medical, physical in nature, the more visible disability of MS. Definitely since the start of COVID, when we're not talking about COVID explicitly, the vast majority of our conversations are now involving behavioral or mood-based terms. People struggling with isolation, depression, anxiety, really finding difficulty with managing their own mental health. So it's definitely a very timely topic for us, and we're very fortunate to be able to coordinate this with Mental Health Awareness Month here in May. So what we're hoping to do today is, through a combination of clips of interviews that we have with some of our own residents and some specialists that are part of our constellation of the mental health care that we try to provide here at the Boston Home, you'll have a better sense of what the residents have been experiencing, especially for those of them who are sort of cooped up for the first part of COVID, where we really had minimal interaction with the outside world, including with families, friends, caregivers, and other providers in the community. I think a good place for us to start today is actually hearing from one of our residents, Nancy. So Vicki's going to play a clip of Nancy describing her transition into our community. She has a unique perspective in that she was living elsewhere at the start of COVID and then transitioned into the Boston Home community in the middle of the pandemic.
Nancy, we're curious to know about how the pandemic and maybe isolation affected you before coming to the Boston Home. Okay. Well, before I came to the home, I was living at home. I had
3 CNAs. So,
What was isolation like at home?
I've been living that way for a long time. It was lonely. It was, although I had my CNAs, it didn't happen very many hours a week. So it was definitely lonely. It was okay when my kids were still living with me. But then they graduated from high school and went off to college. And then I got into a Great Depression because of it. And I feel like I somehow, not damaged, but my symptoms came quicker because I didn't, for a long time, I was really taking care of myself. So I feel like I kind of sabotaged myself a little bit.
So yeah, in this clip, can everybody hear me? All right. So hi, I'm Liz. So in this clip, we talked with Nancy, and she brought up some really interesting ideas about how, you can see all over the place how isolation from COVID and many other circumstances has really just occurred in so many different settings. So even people who were living in the community, many of us who live in the community, we still experience the isolation, the loneliness, the difficulties of really being alone with our own thoughts. And for a lot of people, they have a lot of hobbies, they have a lot of things that they do, but some people are, not really in a position to be doing all these sorts of things and have different ways to channel their energy and really get into their hobbies and their interests when they're really relying on just their 3 CNAs that come, a few days a week. I think that leaves us with a lot of time to ourselves and with our thoughts, and that can really affect our mood for obvious reasons. And in this clip, I am noticing how, the resident is saying that she felt her symptoms were coming on faster, and they were happening a lot quicker after her kids left and moved out. And I think that that's also a big part of it, where we rely so much on socialization with other people to really stimulate our minds, to feel safe. Like one of my favorite quotes from a book that I read in school was that one neuron is not meant to exist on its own, and people are not meant to exist on their own either. It's a system of communication and socialization, reacting, responding, serve and return between people and, our bodies too. So that's really what I gathered from speaking with this resident and hearing what she had to say. But she does have that very unique experience of knowing what the pandemic was really doing to people before going into a nursing home. And it's possible she had different ideas of what to expect in long-term care than somebody who may have been looking into it prior to the pandemic. So there was just this expectation of, knowing that isolation is just part of the new normal, unfortunately.
And if I can just add a little bit more detail for those who haven't followed us over the past couple of years through the pandemic, I'm actually surprised that people are still moving into nursing homes as much as we love our program, but given all the horror stories that were coming out of the initial wave of COVID infections, the Boston Home was fortunately very fortunate to have a couple of waves, but we were able to isolate cases. We did lose one resident, but the rest actually had fairly mild cases of COVID, and we were able to contain and extinguish those outbreaks among the residents while trying as much as possible over the past 18 months or so to rebuild some of our classic programs, reintroducing people into the building, reintroducing group activities that Carrie will talk about in a little while as well too. So even though, again, on a physical standpoint, we were very lucky and able to come together as a community to keep COVID out or really stop it when it tried to break through the doors. There's not as much that we could really do because of regulations and restrictions in terms of trying to stave off some of these other mental health concerns that people like Nancy and other residents have voiced as well too. If anybody does have any questions, again, feel free to add to the chat. Ali and Vicki will let us know if you have any feedback about any of the clips or any of the information that we'll share with you today. But we will come back and hear some more from Nancy later on. But before we do, I do want to introduce Dr. David Rintel, who has graciously joined us today and is going to be sharing a little bit of his experience. He's currently Vice President and Head of Patient Advocacy at BridgeBio. He's also a clinical and research psychologist and who's been working in the field of managing mental health for people with MS and their care community for quite a while, and is a member of our board of trustees at the Boston Home. So Dr. Rintel, thank you very much for joining us today. Greatly appreciate it.
Thank you, Alex, and call me David, please.
Certainly.
And you're going to kind of ask some questions, right?
Exactly.
Okay.
Yes. Do you mind I'm sorry, go ahead.
No, please.
Okay. Just first, tell us a little bit about a snapshot of your experience in working with the MS community, and then tell us a little bit about your model for approaching mental health concerns in people with MS and their caregivers.
Sure. So as you mentioned, I have worked with people with MS and their families for a very long time. If I said how long, you would know how old I am. I think it may be over 30 years. I'm also, I don't like the term caregiver because I think we should all be caregivers of everyone that we know, but I am a family member of someone with MS. My dad had MS, so I experienced it personally. And I guess, you know, everything I learned from talking to adults living with MS, kids who have MS, family members, people with MS. And what I learned is that that mental health and MS is really best described as a process of adaptation. And most people adapt pretty well, just like we adapt to other things in life and other big changes. However, it's a very big challenge to adapt to MS. And I'm just going to bring us back to the very beginning, is that when someone is diagnosed, a person goes from considering him or herself a healthy person and with expectations of doing what they plan to do, and a diagnosis of a long-term chronic illness like MS kind of really changes that and changes how someone thinks about themselves and their future. So they need to adapt to living with MS. I always like the metaphor of being like a train which has been derailed. We always have plans for where we're headed, and I think if those of us on this call thought about like what the next years are going to be like for us, where we know what our idea about that is, and then the diagnosis is like being derailed from that plan, and it takes a while to get used to it and to kind of hoist the engine back on track. And most people are able to do that actually remarkably successfully. And my interventions really were with people who got stuck in that process. Now, MS is tricky because once you adapt to a certain set of circumstances with MS, well, MS can change. And then all of a sudden you have to go through that process of adaptation again. I think what helps is, I like the neuron story. What helps is other people's neurons to talk over what you're experiencing, to take part in the community, to hear how other people have managed, and to be reminded that the initial thinking about life with MS was probably not accurate. Most people feel like their life is over when they're first diagnosed. It just seems so big. But then they find, well, you know, day after day, after a while, their life isn't over, and they are just keep chugging along on their track. And maybe the differences in the beginning are not so great, except for what's going on in your mind. So I think most of us are resilient and most of us adapt to change. Certainly the pandemic was something to adapt to. It was also very challenging and also very isolating, as we've discussed. Um, and I just want to point out that social isolation is one of the most dangerous things for our health. It is as bad as smoking a number of packs of cigarettes a day. We're meant to be with other people. We're social creatures. We're like herd animals. We do our best when we're with other people. And when we're isolated, it just, nothing works well. And one of the consequences, it can bring down your mood. The other, sorry, giving a very long answer to your first question, Alex, so I apologize.
Wonderful. Thank you.
The other side of this is that when your mood is affected, you tend to socially isolate because you don't feel that worthy of connecting. So in addition to being a physical illness, and MS affects people physically, it also affects people's mental health. And that is best described as a combination between some kind of reaction to what's happening, but also it's been found that depression and anxiety are probably symptoms of MS, just like numbness and tingling or problems with mobility or other things that you're experiencing. And the rates of depression and anxiety are much higher in people with MS, unfortunately, than even other people with other chronic illnesses. Depression affects quality of life. It makes it more difficult to interact with others, and we don't get the benefit of other people's neurons as well because we kind of close ourselves off. The good news is that depression in MS is very treatable. It's treated much like it's treated in everybody, but it seems to be responsive to forms of treatment like medication, therapies of various kinds, group therapy, etc. So it isn't, the bad news is that it's more common, and the good news is that there's a lot you can do about it. And I would say anyone who's on this webinar or who knows someone who feels like they're down a lot of the time and they've lost interest in things that are usually of interest to them should talk to their healthcare providers because they may be feeling depressed. Right now, Alex, you get to ask another question.
Thank you. No, thank you. That was all wonderful information. And again, I'm glad you brought up the resilience piece because that's probably, for me personally, it's been one of the biggest lessons that I've learned in working in the MS community for a number of years now is just how do you just get back up and keep moving in spite of all these challenges. Please tell us a little bit about what the format, availability, and utilization of mental health care services looked like for the MS community prior to COVID, and what's shifted in that landscape over the last two and a half years.
So there's bad news and good news. I'll give the bad news first, is that there's an inadequate number of mental health providers, period. And among those, a very small number of people with experience working with folks living with MS or other chronic medical illnesses. So it's been slim pickings for a long time. And that is a challenge. And I think it's a challenge for any of us who've tried to get mental health care for ourselves, particularly for children right now, particularly someone who is experienced in working and living with chronic illness. The good news is that the pandemic, because it was not really possible for most people to go to see their psychologist or social worker in their offices like the usual way it's done or in hospitals. So the government allowed there to be mental health therapy and consultation over the internet, over Zoom, just like we're talking now. And that turned out to be, I think, a really good thing and increased the availability, in particular, the availability to people for whom getting to a shrink's office would be very difficult for a number of reasons. And let me just say that not only is it hard to travel to somebody's office, but often social workers and psychologists and mental health providers don't have accessible offices. So Strangely, we've seen kind of something new and good come out of the pandemic, which is it's still allowable for mental health providers to see people to meet people and treat them over Zoom. I hope that continues. I think it is good. So that's really the major change. But we still need more mental health providers, and we need more mental health providers who are trained and experienced in working with families who are living with MS.
Excellent. Yes, very important. Can you talk a little bit about maybe any new or evolving sources besides just the isolation factor in talking with people in the MS community over the past couple of years? What are some either new or evolving sources of frustration, anxiety, depression, however, kind of whatever mood you want to focus on that you're hearing from these folks?
So the pandemic has been difficult and frankly scary for all of us. And people with MS who are on immunosuppressive medications learned that they were not developing antibodies in the same way as other people. And so that meant that when many of us felt like it was safe to come out of the house and interact a bit, many people who are on immunosuppressive treatment felt like, well, it's not safe and I need to just isolate myself, even the same way as during the early days of the pandemic when we didn't understand COVID and we didn't know how it was transmitted, and the best thing you could do is just stay home. So I think it's been a greater challenge. Now you know that there's a new medication. I'm not an expert in it, but Evusheld, which is meant to help people on immunosuppressive drugs build antibodies. But I think that that anyone living with any chronic illness is likely to feel much more vulnerable to COVID, let's face it. And in particular, people who are vulnerable because of loss of mobility, and loss of mobility often makes other aspects of life much more difficult, like lung functioning, et cetera. So it's been really tough on our community.
Absolutely. So let's try to bring it to hopefully some more positive takeaways. What are some bullet points or tips that you might recommend for people, and really in any setting, people in the community, people in a care setting like the Boston Home who have MS, as well as their extended community? What are some things that they can do for themselves, and what are some ways that they can maybe open a dialogue with their existing care providers about mental health concerns?
I'm sorry to have been a downer, Alex. I usually try to do the opposite. So, so number one, I'm going to answer the last one first, is that all medical providers, all healthcare providers should ask all of us if we're experiencing a mood problem at every visit. Let's face it, both people with MS, their family members, people who don't have MS are subject to mental health problems, and if you don't ask, you may not find out. And you should not only ask the person who's you're seeing, but you should ask their partner, because it's often the case that a person doesn't really want to admit that, but their partner will say, oh yeah, my partner is really feeling down and I'm really glad you asked. So I think we should all, if your healthcare provider doesn't ask you when you go to visit, you should say, hey, you should really ask me about that. So I think we could all sort of promote that. So now I answered your last question and I forgot the beginning parts. So you're gonna have to repeat it for me, Alex, I'm sorry.
Or just any other takeaways that people with MS and
yes,
the people
okay.
in the MS community can just
Okay.
start thinking about in terms of self-reflection or moving forward in managing mental health.
There is a clear antidote to social isolation, and the antidote also works well when your mood is low, and that's to connect with other people. And that is something that we all can do. There are almost very few people who are unable to reach out and connect with another person. So one positive, again, that came from pandemic is I facilitate a group for men with MS. That's a plug, and if you're interested, please let me know. We're always accepting new members. And meeting on Zoom, although, you know, I'm not saying that Zoom is ever better than real in-person human-to-human contact, but meeting on Zoom has made that everyone has been able to attend because they don't have to leave the comfort of their own home. And people who've moved out of the Boston area have been able to attend from where they live. So, so that's been a great way to connect for them. I'd say try to encourage people to make a call every day. There's someone in your life who would feel really happy to hear from you. I think also going out of doors, the weather is better. The transmission of COVID, I say this not as an epidemiologist, but the transmission of COVID out of doors when you're not in a crowd and it is next to zero. So putting some chairs out in front of where you live and chatting with people and getting together outside or inside if that feels safe to you, I think that's the thing to do, is to make connections, to allow your neurons to interact with each other and check in and share news and enjoy the presence of others. And I think we all feel better when we do that.
Excellent. Thank you so much. That was all wonderful information and obviously very important. I think one of the unique things about thinking about mental health is that we're all in this together. Many of us are experiencing the same symptoms, whether we have MS or we have someone in our care group or in our family that has MS, that we're all sort of becoming more introspective and aware of it. So it's good advice for all of us. Thank you. Does anybody have any other questions or wanted to build on any other points that David brought up?
I just had one comment or a question, and I apologize. I did have to turn off for just a minute, so I apologize if I missed this. When we spoke previously, David, I think you had a great or valuable suggestion that people get to know a mental health care provider before they really think they need one, so that they have some relationship base existing. And I thought that was a great suggestion. So I wondered if you could just speak to that.
Yeah, I think when you feel, if you wait and you feel like, oh, I really need to find a mental health provider, it can take a really long time, unfortunately, again, because there are too few and too few that have knowledge about MS and other chronic illnesses. So I would really encourage that around diagnosis, to have a check-in session. Sometimes it can really be helpful to meet with someone once or twice, and then you know someone that you could call down the road. And you may just need to have a brief phone call and say, hey, I'm stuck here. And, you know, again, this is, if you think about the process of adaptation, you want to continue moving forward. And if you get stuck, then you're in trouble. So having someone to consult with then can be very, very useful. So thank you for remembering that, Victoria. And I also want to thank Victoria and Alex and the Boston Home and the sponsors for bringing us together today. I'm really honored to be part of this.
Thank you. We
Excellent.
appreciate you being here.
Thank you very much. Last call for any questions.
If I was too much of a downer, you can call me and complain 24/7. Okay, so.
This is Beatrice. I had mentioned I had just wrote, and Alex, it was good to see you. And I was suggesting that playing games, triggering memories, recall, all those types of things that help us. And then, like the doctor reminded us, if we make a phone call to one of our friends or a family member just to chat, just to keep up with individuals in our life, and those types of things have been helpful for me in the last 3 years, 2 years. And so I appreciate everything that the doctor was saying, and being involved with the community that you're with, MS community. There are a lot of locations that have MS groups once a month or twice a month that they meet. And I haven't been to one recently, but I participate in community centers, and so those places are, we play games, we have lunch, and all those types of things that you do with other people, in a safe way, of course. Outdoors is best now. So
Thank you, Beatrice. And I'm going to pick up on that. And it's great to hear from you, first of all, Beatrice. And also, I love that you mentioned outdoors, because that brings us right into our next clip. So I think we can bring
Okay.
that up if that works, Alex.
Yeah, no, I was just going to say that's a perfect segue into Nancy's additional comments about our outdoor space and how that's been therapeutic for her.
Thank you for the segue, Beatrice.
you're welcome.
You have this unique experience of living in the community during the pandemic and then moving here during the pandemic.
Right.
And it sounds like isolation happens, in all sorts of settings.
Right.
What was different about being at the Boston home?
Well, there are other people here.
Yeah.
Whereas when I was home, in Granby, I was pretty much alone. I had my CNAs, but they were limited hours. So I was pretty much alone.
And what is something that has been really helpful for you in supporting your mental health or connecting with other people?
Right. The garden is definitely, when I first got here, it was summer, it was hot, but going out in the garden, still there are places where they're cool. And I was able to connect with people there.
Yeah, just with the flowers, the trees, and sitting by the koi pond like a lot of
Yes.
people do.
And so for years, I was only in my apartment. I was able to, drive around the building, but then it was very limited on where I could go and what I could see. So being here, just having the garden was really helping me adjust here and everything. So I'm just waiting.
You're getting excited.
Yeah, waiting to be able to sit out most of the day and connect with people again.
So in this clip, it was interesting talking with Nancy about the garden, because I think the garden is honestly one of our best assets here. It's one of the most therapeutic things that we have here at the Boston home. And I liked how Dr. Rintel actually mentioned, the best antidote for social isolation would be socializing, being with other people, getting out and doing things. Beatrice, you also mentioned being outside. It's so important to do that. And I think that there are a lot of times where people during this pandemic have felt really, really sad and really lonely, not having as much socialization and opportunities to be with other people as they had before. And then also this element of fear. We talked about anxiety that people experience because of their disease or because of the pandemic. And then also the combination of these things, and feeling like you're sort of caught in between really craving and yearning for socialization and also being kind of scared of it. And, we're afraid of, being infected, and that stands in between us and getting the socialization that we need to thrive. And what I like about what Nancy had said was that, the garden's a great place to just be around people. It's a way to just kind of ease back in a safe way, because I think we've, in a lot of ways, been just stuck in survival mode. And in survival mode, we've had to isolate ourselves, quarantine, and that kept us safe from infection. But it was really hard for us mentally and emotionally. And that's where people start to decline, psychosocially. And so being able to sort of ease back in, dip our toes, and experience this in a safe way and get out of survival mode as opposed to just cannonballing right back into socialization, I think has been really helpful. And the garden has just been such a great facilitator for that. It's almost like a transitional sort of object for us in this environment. people can go out there, spend time together without being stuck in a room together. They don't have to be really close to everyone, or they can be, having conversations with other people and enjoying something that is really a shared interest for them. Because honestly, we do need socialization so much, and it's so hard to get out of survival mode, especially when we've been, scared into it for so long. And there are so many things that are unknown. We always say that we don't know what infection control guidelines might be, a week from today, a couple days from today, and that can be pretty scary too. But being able to sort of, dip our toes in the water and then ease back in before we really make a big splash is, I think, really helpful. And the garden has just been, a huge help in that. I think that a lot of the residents have been saying that they just can't wait till the weather's nice. I can't wait until it stays nice, and then we can all be out more and enjoying ourselves and just getting back to this, this sense of belonging and being welcomed, as opposed to like, oh, well, are you supposed to be out? Are you on quarantine? And I think that this has just been a really big opportunity for people to get back out there, start easing back into the lives that they were really comfortable in, and in a safe way, getting out of survival mode and connecting with other people again. We're sort of learning how to do this all over again. And the garden has just been a great way for us to do that.
Absolutely. I know we start talking about it usually with the residents on January 2nd after the holidays are done. The garden's going to be opening soon. It's sort of our barometer for better days ahead. I want actually, before we go to the next part, Carrie, do you mind just talking? I'm going to bring in Carrie Donahue, our director of activities, because she's been at the heart of social and emotional wellness in our facility for a good number of years now. Can you just talk just for a minute about what are some of the things people have been talking, or residents have been talking to you about in terms of wanting to get back into socialization, either things that they want to do maybe that were different before COVID, or of course, what are some of the challenges to people getting back into the same routine with group activities and outings like they did before?
Certainly. Thank you, David, and thank you everyone for joining us today. I know the residents are eager to get back to outings for sure, getting out into the community, and we're doing a lot to try to bring the community in. We have thankfully been able to open up more and have family members visiting, entertainers visiting, lots of different group activities, but they really miss being able to go out and experience the Red Sox games and the concerts. And some of the challenges with COVID right now is with transportation. So those are things that we're working on, but we're still in small ways trying to bring the outside in. And we've just recently started to do dinner nights, takeout dinner nights, inviting, having the residents order food and gathering together in a group to be able to do that. We have noticed with COVID, of course, like in many communities, that there is that element of fear that you mentioned. And so some residents still, it's almost become a new habit for them to stay in their rooms, whether they feel comfortable or the depression has sunk in and they're unable to really come out of their rooms for many different reasons. That has been a challenge to try to motivate some of our folks on nice weather days in the garden, being able to go and talk with them specifically and saying, just for today, why don't we go outside for a little bit and get 20 minutes of fresh air? And then when you go out and you see them talking with another resident, or a family member stops by to chat with them, and you see their brightness in their face and the excitement to be outside, it's small things. We're trying small ways to get them back to doing the routine that maybe they did before. Of course, we have others who the second you opened were lined up to go to their favorite groups, and whether it was art or coffee or to see an entertainer. But there's others who still, for lots of many reasons, are struggling. And right now, our staffing in activities is going to be real robust for the summer. So we're hoping with that robust activity staff that we'll be able to make headway with some of those residents who have struggled more.
Excellent. All right, thank you. And Carrie will talk more about what she and her team are doing to get everybody out of the COVID funk as much as possible a little bit later on. But I do want to shift over to a another speaker who was not able to join us live, but he graciously recorded a few responses to some of our questions. So we're going to hear now from Dr. David Bullis. He is a clinical psychologist. He's also the director of behavioral medicine at the Mass General Hospital Cancer Center at Newton Wellesley Hospital. So we asked him some questions about his experience in working with the MS community, which he did prior to his work with the Cancer Center, but he also is quite frankly still working closely with people who are managing chronic and life-altering diagnoses, whether the word cancer or MS is sort of the code that goes with the person's medical information. So I'm going to ask Vicki now to share some of Dr. Bullis's talking points.
Sure, Alex. And I think in this first clip, Dr. Bullis touches on what Liz and Carrie were just mentioning about fear and uncertainty and how that has contributed to mental health. So we'll start with that one.
What are some new or evolving sources of anxiety or triggers for depression that you're hearing as a result of, you know, you said the isolation or other factors during the pandemic?
The core principle, right? When I talk with people, and this has been a core principle that has developed in my mind over the last, 25 years, is that the core issue that really drives depression and anxiety is this loss of control, that I don't have control over my body. I don't have control over my healthcare in general. I don't have control over what's happening to my physicality, right? And that's sort of the primary wrestle that people wrestle with around MS, as the MS is beginning to develop. That sort of gradual loss of control is really that's where the work is in many cases. It's very similar now with cancer, that we talk a lot about. People were going along, minding their own business, and all of a sudden, pow, they're all of a sudden in this brand new world, which they had no interest in being in. And they don't have any control about climbing back out of it just because they didn't, they don't like it. So that's always been true, right? That has been true since time immemorial. So that's not different now in COVID. What is different is that on top of that, there are just layers of things I don't have control over, right? So I don't have control over my body per se. And then I don't have control over the fact that I can't get in a car and go see my friends and have lunch, which is one of the things I used to do to help myself feel better, even if my body wasn't working. I don't have control over that. And then the other issue that what I always talk about, the main enemy in medical care is really uncertainty. And so if we think about why do people get anxious, it's because we don't know what's going to happen. I don't know what my body's going to do. I don't know how this is going to progress. I don't know if I have days, weeks, months, years, decades of having to manage these feelings. That uncertainty is the crux of where a lot of the anxiety comes from. So you can imagine if I already had uncertainty about what my own health was going to be like, and then I layer on top of that the uncertainty of what what the pandemic's going to do. And so partly sort of helping people understand, like, that's really the leverage point. Like, I want to reduce uncertainty by focusing on what I have control over.
All right. And then the next one, I think Steve's going to talk a little bit more about people making up for lost time during the pandemic.
In the beginning, there were just so many heartrending stories about family members who would end up in the hospital and then they could not be visited by a loved one.
Right.
And that had an impact on them as a patient, and it had a huge impact on the family. So I think that's something that we're now also really beginning to understand, that the longer term, there's a long tail, like the bigger impact of the pandemic has, it's sort of essentially past us for the most part. We're still dealing with new iterations, but the longer tail in terms of its impact on us mentally and emotionally is just that, people who were primed to be the loving, supportive, caregiving family were sort of removed from that ability, prevented from doing that because of COVID precautions and all that sort of stuff. And I think that just is a hard thing to kind of wrestle with because you can't get that time back, right? And
Exactly.
illnesses like MS progress along, at whatever pace it does for any individual. And we can't just freeze somebody, say, hey, like, I can't come see you, but I'll be back, in 2 weeks or a month. And we'll just pick up where we left off. And I think that's a heavy load for people to sit with in a lot of ways. And that's where the technology piece can be useful.
Mhm.
Having a meeting with your loved one over the phone is better than having zero contact, but it doesn't replace a hug or a kiss on the cheek. So I think that's something we just need to be aware of. And then, it's one of those things, like, if you think you're depressed, it's a pretty good guess that you probably are depressed. People don't tend to think they're depressed if they're not. You
Sure.
don't tend to think you're anxious if you're not actually anxious. So trust yourself. I mean, like, if that's what it feels like that. And I think that's what I was saying earlier. That doesn't mean you're mentally ill. That just means that you are suffering the reactions of the reality of what we're all going through.
Sure.
So that's job one. Job two is, in terms of accessing care, the three areas I think are useful. One is that if you have insurance, that on the back of your insurance card, there is a behavioral health number. And you can call that number and say, look, this is my situation. I would love to talk to a therapist, either virtually or in person. And this is where I live. And the health insurance has a list of providers who you can call. There's often waiting lists and other things, but at least you know that there's people that's a place to start. I think the other thing that's actually sort of underutilized is the sort of support groups. And again, one of the things about the fact that these emotions are normal is not that you need to have necessarily, a psychologist with 25 years of experience. Like, just having somebody else to sit with and say, does this suck and how, is also just lightens the load a little bit. And the MS Society of Massachusetts and nationally, has a list of those support groups. And a lot of those support groups have gone virtual right now, which is both, I think, good, at least at a entry level, but it also may give you access to more in-person groups over time. And then I think the other thing is, like, asking your providers, like, you already have providers. So who do they recommend in your community? And then if you're in the community and you have a support group, for example, asking other people in the support group, who do you talk to about this? Who's your psychologist? Who's your social worker? Who's your whatever? And, people kind of develop expertises because if they're good with one person, then the word spreads, and that can be a useful kind of litmus test. So I think those are sort of like asking your insurance company, checking out support groups through the organizational societies like the MS Society, talking with friends and family about who they talk about these things with. Want to do a self-assessment, again, kind of is what it is on the end. Like, if you're feeling that way, it's real. And it also is treatable. I think that's the other piece about this, which is where the action item comes from. People are oftentimes aware that they're sad, depressed, worried, frustrated, angry, resentful, whatever. And then just think like, but that's, what are you going to do? I just got to sit with it. Everybody else is feeling the same way. And I think in a lot of ways, if we can be like, I'm feeling this way, and maybe there's something I can do about it. Like, so I think we as a community, I think, want to support people talking about and getting the help when they can.
I'm going to go right into Dr. Bliss's last clip where he talks about small steps people can take in daily life.
And it turns out that one of the best things for wellness, right, is to be engaged. So even if it's not about psychotherapy per se, if I feel less isolated, I'm going to feel less depressed. If I feel more engaged in my community, doing things with other people, even if I live in an apartment building, and I encourage some of my apartment-bound clients to be like, just go down and check out your mail, get your mail from the mailbox, but don't come right back up. Hang out, sit around, talk to people when they come in. You'll feel less isolated. It's not, like a major intervention. It's just really recognizing that the things that have been getting in our way we used to take for granted. We used to take for granted that I could just go to the grocery store and see people. I used to walk downtown and I could go to this favorite restaurant and I'd talk to the waiters so they knew me, and I talked to the other people who were there because we were always there at the same time. We forgot about that. We forgot that that was sort of embedded into our lives. So beginning as you know, as the season, and you know, with any luck, COVID will be fading over the summer. Being able to kind of remember that those simple things, getting exercise if you're physically able to get exercise, those basic ideas can actually go a long way toward reducing the stress. Now, if you're feeling like you want to hurt yourself, or you're desperately depressed, or you're in a panic, going for a walk is not going to make that all go away. That's when you really want to get professional support. But so there's a range, right? And my view is, if you do this, the low-hanging fruit, like getting out of my house and getting exercise and seeing friends in any way I can, that will reduce a lot of the distress. And then what's left over, right? If there's still depression and anxiety and unhappiness after that, then in addition to those things, you then talk to your medical providers about who they recommend. And then if that is enough, then great. And if there's still more, then you can add on. So you can sort of layer the supports much in the way the stress has been layered, right? It's sort of like, for each layer of stress, there's a layer of support that we can sort of work on, you know, infusing into our lives. The reason why, and there's the hook for the hope, right, is that a lot of that is we have the power to do that ourselves. Like going down and checking my mail, I kind of have to do that anyway, right? So let me then make the small choice of not coming right back up to the safety and of my isolation, but recognize that if I just spend a little bit of time chatting with people, I feel less alone, right? And that can sort of remind me like, oh, right, yeah. This is something I used to do, really love it. And if we all could begin to do more of that, that will be the beginning of the end of the helplessness.
Excellent. So again, great points from his clinical and personal experience as well. I do want to include one more voice from our resident community. This is Lynn, who has been with us for a number of years. So she has experienced pre-COVID as well as we're not post-COVID yet, but our current community in the Boston home. So she's going to share some of her observations and experiences as a resident.
Like you said, you've been with us for about 8 years. Tell us, what are some of the emotions that a new resident might have going back to when you first moved in? What did people kind of go through during their first year at the Boston home?
I don't think that I'm a good person for that, because when I came, I was so happy to be here that I didn't have any of those sad feelings. I had lived on my own for so many years that it wasn't like I missed a family. You know, my kids came to see me. They came to see me before. My mother came to see me. My mother came to see me before. So there was no real change in that. A lot of people, when they first come, if they come from home, they miss their spouse really bad. Some of them have a very difficult time with it. And I don't know that there's anything we could do to make it easier for them.
So since the start of COVID, which is technically only a little over 2 years ago, though it feels about 2 decades at this point, what are some emotions, or what are some different feelings or thoughts that you've heard people say as residents, either people who are new to the community or people who've been around for a few years like yourself? What are some different, new or different things you've heard in the last 2 years?
Well, different forms of claustrophobia. You know, you're stuck in your room. Sometimes you have to keep the door shut, so you can't talk to your friends or see your friends. And that's hard. That's really hard.
Mm-hmm. Absolutely.
I think that my day-to-day living is very much like it was before COVID.
Great.
You know, I go to the groups I went to. I see the people I used to see.
Do you mind just telling us a little bit about some of the groups that you take part in?
Oh, I take part in watercolors. I don't know if you can see any of my paintings on my wall. I have it decorated with a few of my paintings.
You've gone back to being a resident representative on the
Right.
resident council.
Yep,
Excellent.
I just got voted back in.
Congratulations.
Thank you.
I think the last big question I have is, what kind of resources do you think would be helpful for residents who have really been struggling with negative emotions, especially during the pandemic, feelings of abandonment, isolation, depression, anything along those lines?
Well, we could offer them more counseling. I mean, I know there's some counseling here,
Mhm.
but I don't know if it's enough for some of them. Some of them are really sad, and we need to deal with that. For some people, there's too much interaction. For other people, there's not enough interaction. So I don't know that there's one thing we could do that would fix everyone. It's really not a hard place to love. If you just let yourself love it, it will work.
Excellent. And then with the time we have left, this would probably be a great place for Carrie to jump in as well and talk about the more than one thing that Lynn recommended. So talk a little bit about what we're doing or what you're helping us all to do with improving socialization and getting people re-engaged within the community.
Sure, thank you. You know, what Lynn said right there was just, if you love it, it can be a great place, and that really resonated with me. We often talk to residents, especially new residents that first move in and others who are maybe struggling, to just say, you know, pick one thing, connect with someone. We've heard this over and over again. You know, some of our residents, it might not be the activity team that they're connected with, but they go to the gym on their 2 days and they have connections with the rehab aides, or it's the housekeeper that brings them the laundry that we don't know about, that they talk about their families to all the time. So really making those connections with residents, with each other, with other staff members to socialize is super, super important. And when they engage in our activity program, it really helps to give them a sense of accomplishment, to create some identities that maybe were lost either during the isolation period of COVID or just with the many years that they've had MS, that they've dealt with losses. Friendship and laughter, I think we don't give it enough credit, but really when you see residents in a group like exercise group and a song comes on that they love and they can recall it and they can laugh about an experience that they had, you can just see their mood really boost. We have, you know, animals now. We have an aviary, we have the koi pond, we bring in barn babies, all the animals, and really that nurturing spirit that they all have as humans. I think we can all say that we have this feeling of wanting to nurture and care for each other, and that's the same for our residents. And we notice that when the barn babies come in and they get to cuddle the little chickens or cats, kittens, they just are their face light up. You know, you can see their body language change. And those things are just super important for them. They do other simple things for their friends, helping them in and out of elevators, going to check on them out in the garden. Those things are just important for our community, and keeping them engaged any way we can with entertainment and art. When you talk about mental health, we're really trying to be more robust with meditation, yoga, exercise, spirituality groups. It is not a one size fits all when you're creating a calendar. It's really individualized, but in a group setting. So do people have interest in history, in art, in theater, in music, and then really shaping that program around everyone's interest and creating small pockets of friendships that can really be fostered, and it's beautiful to see. Something else I just wanted to briefly talk about is that when residents are having trouble, having challenges with their mental health, it's often the activity department and some of our leaders right here in this room that host groups that really recognize that first and foremost, because we see a change in them in those groups. We see either a lack of participation while they're at the group, maybe they're not coming anymore, they're more withdrawn. And what we can do with that information is really connect with Liz, connect with the doctors, and try to see what other interventions we can offer to them, and have conversations directly with the resident and just say, look, we're noticing this, how can we help you? And that's really important too for the community. I don't know, Liz, if you wanted to mention anything on that.
Yeah, so like Carrie was saying, obviously the activities department offers a huge, robust system, just program of life enrichment activities. And I think that another thing that we've mentioned is that there are so many different ways that residents can connect with somebody or something. It's not always going to be an activity, but it could be a person or some other thing that they do. So like, for example, I run a hopeful healing group. It initially started out as grief and loss, but that sounded a little too dark. And so we started off by discussing how people are doing with losses in their lives and the losses that they have had, such as the loss of their mobility, the loss of their independence, not being able to drive a car anymore, not being able to take care of themselves, the death of a loved one or a friend. We've also talked about the pandemic and how, in a way, it is, like I mentioned before, it's thrown us all into survival mode, and that is just, it's a trauma itself. And so it's a place in this group where we can acknowledge what people are going through in a non-judgmental environment, and people can discuss where they're at in this process. It's almost like going through the grief process, getting back out into the world, and people are learning how to accept it and to cope with it. So yeah, I think that the activities department and just everything that the staff do and the residents do for each other and families do for everybody, that's really important, because there's always going to be somebody who appreciates what's being done and appreciates having that time and space to be a part of something special.
Thank you, Liz. Yeah, I think family is really important. I know we wanted to touch briefly, and I see a lot of family members here in our group today, to just mention how vital they are to the mental health of our residents, and how coming in to visit was so uncertain for such a long time, and how the Boston Home really tries to foster those relationships. And when we speak about safety in the garden, some of the great events that we had this year were the tree lighting in December, when family came and we could light a tree and sing songs and share with each other. And then the art show is always a wonderful event in August, where residents showcase their art and families are able to come and join us. So the more that we can continue to foster those relationships and have ways for the residents and families to interact, are only going to be, again, more positive for our residents' mental health as well.
All right, excellent. Thank you all for those of you who were able to stay for a few extra minutes. I know we're going over time, but we have a lot to unpack with this topic. I do want to open up to any questions that people might have. I do have one that came up in the chat already that I'm going to start with, which is a question, a very important consideration. If you are immunocompromised, how does socialization work if you're still needing to or feeling much more comfortable wearing a mask? And I can completely appreciate actually the work that I do as a speech pathologist on two levels. First off, the mask clearly masks facial expression and can interfere with how clearly people can have a conversation, even face to face sometimes when there's background noise, but better safe than sorry. The other thing too I work a lot with is people who have swallowing disorders. So many socialization activities involve food, eating, drinking. So that can be quite a challenge. I think Carrie and her team did a great job as much as they could during the pandemic to still offer. We usually do a daily coffee hour with news discussion, as well as being able to keep up with some of the eating social activities, just making sure that people had the appropriate social distancing in place. It's a little bit easier with our folks who have the powered chairs. They just really need to have a good amount of space for their own mobility. They really can't squish in with other people. So that still allowed them to have a little bit of distance, maintain some degree of infection control, but also be able to eat and converse with other people in a group setting. Does anybody else have any other recommendations or thoughts about, again, mask use? That it shouldn't be a touchy subject, but but it is, and it is tragic that when people are clearly doing it for their own health and safety, that it would even be something that creates this awkwardness during social engagements.
I would just say really the resilience, going back to your point, Alex, is that we've really seen resilience with our residents. They would do almost whatever they could so that they could be with one another, so whether it's wearing a mask or being on Zoom for a trivia game because there was no other way to really be able to interact with each other, they were ready to do that. I think MSK, with a lot of the losses that faced over the years, COVID, they just said, we'll do it. We've already dealt with a lot of stuff. We'll deal with whatever we have to kind of get ourselves through it. Now, that's not everyone. We have 96 residents, so I'm talking the majority. We do have some that struggle with masks and not wanting to wear them, or some of them that still want to and may skip an activity because they don't feel safe. But from the majority of them, I feel like they really just wanted to be back together, and they would do what they needed to do to make that happen.
Mm-hmm.
Yeah, and then another thing, I know we've talked about like video calls a lot, and I think that that's one of the really big things that has come out of this pandemic, that people are kind of forced to have to get a little bit more tech savvy and try different things. Being able to FaceTime or do Zoom calls or Skype, whatever it is, I think has really helped people. And using their devices a little bit more productively, I think that's been really helpful. Even if we were kind of like forced into doing this, if we were forced into adapting to it, that is one of the strengths that I think a lot of people developed throughout this.
Absolutely. Looks like we're getting some upvotes to hear from Reverend Johnson as well. So sorry to split up your time, but Reverend Johnson, would you mind telling us a little bit about what your experiences have been about about using your approach towards spirituality among our residents, and how you've seen that help them cope with challenges throughout the pandemic?
Oh, you ought to know better than to ask me to have a couple-minute conversation before you shut it down.
Fair enough.
I mean, what's going on? No, I've been through different evolutions of my ministry here. I greatly enjoyed leading like Bible study groups and prayer groups and worship, and I work closely with activities and with the social work department. People, I offer to pray with anybody when I walk in, and they will say, no. Some of them say, no, I'm not a religious person. But I say, well, can you tell me your story? Can you tell me who you are? What's your journey like? We don't have to make it a religious journey. And so I have to adjust to who I'm seeing. And I like that. I like them to feel free to talk to me about whatever they want to. And sometimes, as we've talked about, that's helpful. Making deep connections through activities, through social work, through your work is what it's all about here. And so I try hard to do that. And so I guess I'll end there. I liked what I heard. Everybody was talking around and about things that are important to me.
Well, I think we have a great topic for our next webinar here as well, too. So that's a good intro to that as well. So
you can't go wrong. There's plenty of stuff to talk about here and to reflect on. And people share stuff that breaks my heart sometimes, and other times makes me want to sing. Mm-hmm. It's just a lot of struggle, but resilience and people and the way they look out for each other. They really form a community, and they know how to do that.
Thank you for reminding us that there is always hope. And I think one of the common threads we've had throughout our conversation today is definitely connecting with others, connecting neurons, connecting care partners with people who are really struggling with some of these more invisible symptoms resulting from the pandemic and from just managing a chronic condition like MS. Were there any other questions? Did I miss any from the chat, Ellie? Or did anybody else have any other questions you wanted to offer or comments for us?
No new questions in the chat, Alex.
Okay.
I don't have a question, but I just want to thank all of you for offering this webinar. It was really informative and very validating for me and my family to hear all of you speak about what it's been like for the residents at the Boston Home and to listen to Dr. Bullis and Dr. Rendell. I really appreciate the time that you've given us today. Thank you very much.
Great, thank you. Obviously, we learned a lot from families and from our greater community as well too. But it's an ongoing conversation, and I'm hoping that we can come back at some point, hopefully not too many years down the road, and find some more successes that we've been able to have in terms of getting back to the old normal as opposed to the new normal. But it is going to be a process for all of us, I think. So thank you for joining us again.
And thank you, Christine. I just wanted to add, you've been very generous in sharing your family story with us to help others as well. So thank you for that too.
You're welcome.
Okay, I think we are about 15 minutes over, so this is probably a good time to wrap up. But thank you all for joining us. As Alex said, I think we do have some topics for future webinars if you're interested in joining us again. And I think you can find contact information on the Boston Home website, which is thebostonhome.org. If anyone had follow-up questions or things they might not be, ready to ask in the chat, but wanted some further information on, feel free to reach out to us that way. Thank you so much.
Great. Thank you.